Welcome back to the PAH Initiative video series. I'm Dr. Lana Melendres-Groves, a pulmonary arterial hypertension specialist and director of the Pulmonary Hypertension Program at the University of New Mexico. I have been treating pulmonary diseases for over 12 years, with a specialization in PAH for over 9 years. My clinic has treated over 5,000 patients, and I currently oversee 250 PAH patients on PAH-specific medicines. In this video, we'll discuss the goals of treatment and plans to address those goals. If you haven't seen the PAH Basics video, it's better to watch that first. Goals are important to help us assess whether treatment is working well enough or if there's need to make treatment changes. My PAH patients usually have their own personal goals in mind, and as a pulmonary arterial hypertension specialist, I have clinical goals for my patients as well. Fortunately, these goals work hand in hand because achieving clinical goals may help patients achieve their personal goals as well. Although the words are different, the important thing is that you and your doctor discuss your treatment goals and make sure you understand each other. Personal goals for patients with PAH often include experiencing fewer symptoms, such as fatigue and shortness of breath, spending less time in the hospital, or not being hospitalized at all, being more active, or even spending more time with friends and family, and getting out more. Physician PAH treatment goals include improving right ventricular heart function, having healthier blood vessels in the lungs, and slowing disease progression. Let's talk about how you and your doctor can work together to reach these goals. I want to start by familiarizing you with the phrase risk status, which you might not have heard of before. Risk status is a different way of looking at your PAH. It involves some of the tests that your doctor is already using to monitor your status. But it goes beyond just looking at how you're doing today. A risk assessment uses the results to predict how your PAH may change over the next 5 years. PAH specialists now consider improving your risk status as an important treatment goal. Risk status is either low risk, intermediate risk, or high risk. Low risk means that there's a low chance of your PAH getting worse. If your level is intermediate or high risk, there's a higher chance that your disease will get worse. When PAH disease gets worse, it's referred to as disease progression. If your status is high or intermediate risk, your doctor may want to consider changes in your care by adjusting your treatment plan to help improve your risk status and lower the chance of your disease getting worse. Your doctor will look at a number of different factors to evaluate your risk status. 3 commonly used assessments are the 6-minute walk test, NT-proBNP and BNP, which are blood tests, and functional class. Let's consider each of these assessments a little more closely. You may already be familiar with the 6-minute walk test. It is a test to see how far you can walk in 6 minutes. Performing a 6-minute walk test at each doctor's visit provides an important view of your status over time. This helps your doctor assess whether your treatment might need adjustment. You might be interested to know that the average walking distance for patients with PAH in 6 minutes is approximately 350 meters. Patients considered low risk can walk more than 440 meters in the walk test. And the average distance for people who do not have PAH is between 590 and 640 meters. Did you know that a meter is slightly longer than a yard? In other words, a 100-yard football field is a little over 91 meters long. So 440 meters is equal to a little less than 5 football fields. Being able to walk further during your test indicates that your heart, lungs, and blood vessels are functioning better than when you did not walk as far. Improving walk distances over time is a goal PAH doctors set for many of their patients. This is one part of the larger goal of trying to improve risk status. Another test that's considered in risk assessment is a blood test called NT-proBNP, or BNP. BNP is a chemical the heart makes when it is strained. NT-proBNP is another form of this chemical. So it makes sense that there's more BNP if the heart is under greater strain. Although no one test determines your risk status, an NT-proBNP greater than 300 nanograms per liter and BNP greater than 50 nanograms per liter indicates that the heart may be working too hard. Functional class is another type of evaluation that can be used to help assess risk status and is an indicator of your capacity to physically function. How much activity you are able to do without experiencing symptoms determines your functional class. Class 1 means you have no symptoms with ordinary physical activity. Class 2 means you have symptoms that slightly limit your activity. Class 3 means that your symptoms significantly limit your activity. And if you have symptoms even while resting, that is considered a Class 4. Functional Class 1 and 2 are associated with low risk status. What I tell most of my patients who are high risk or intermediate risk is that we should strive for low risk status. In 3 to 6 months, we'll see if we've gotten there, and if not, we will consider what else we can do to help them try to achieve their goal. Talking to your physician about your risk status is a starting point for setting goals and creating a treatment plan. Once again, healthcare providers assess risk status using 6-minute walk test, BNP blood tests, and functional class, as well as other tests. Changes in your test results can show how your treatment is working and if your treatment needs to be adjusted. I'll leave you with this tip. Be proactive by making a list of your treatment goals to see if they match your healthcare provider's goals. Ask your provider if lowering your risk status is one of your treatment goals and what more you can do to meet your goals. Thank you for watching PAH Treatment Goals. Watch the next video in the PAH Initiative video series to learn about working with your healthcare provider to learn about treatment options available today.